Well, welcome. My name's Dr. Christopher Gallagher. I'm a breast medical oncologist, medical director of cancer services at MedStar Washington Hospital Center, and I'm here today with Dr. Brufsky to speak briefly about the importance of the patient's perspective of real-world evidence in formulating conversations about how we discuss this with our patients. So, Dr. Brufsky, what are your thoughts about how we use real-world evidence into our conversations with our patients?
I think at the beginning of the day, at the beginning of it all, it's all about an individual patient and an individual physician talking to each other. I think together and kind of, the way it's always been is we have our own internal real world evidence. We know the patients we have personally treated. I think the way things work is that we'll have a trial presented at ASCO, some big phase 3 trial of San Antonio breast cancer, and we're at ESMO now, or ESMO breast. And we'll say this is practice changing. And so, but we never used it. And so then we'll want to use it, that at least the big practice changing at least allows it to be reimbursed. But then we use it. And I think we internalize our own particular real world evidence. So I think what real world evidence helps us do, these, analysis of these large databases of hundreds of physicians like us, examining patients and recording the data in the real world, it helps us kind of round out some of these discussions with the patient, because the patient will come to you and they'll say, I don't really fit, or you'll think in your mind, this patient really doesn't fit the clinical trial. This patient was, say, African-American, and there's only 2% African-Americans in the study. This patient's Asian, there's only 3% Asians. Or this patient has cardiovascular disease, or this patient is over 75. And you're thinking to yourself, there really weren't that many patients in the randomized trial, so what am I going to do? And how am I going to advise the patient? Because the patient's coming and asking, and you're kind of talking to them about kind of together what you're going to do. It's shared, you're sharing the decision-making together. And I think that having data that goes from outside of the clinical trial is really helpful in making those decisions. And then because the patients go, I'm 75 years old, and most of the patients, that you're telling me about in this trial were 50 or 55. How do you know it's going to work for me? And I think that's the nice thing about this. If it's done well, if there isn't a lot of bias in the data, I think that it can be very helpful in those discussions. I don't know how you feel about this, but I think that's kind of how I use it on my own to kind of reinforce my own personal real world evidence.
Yeah, I think in listening to you, what I'm also sort of thinking of, we sort of like to think of the real world evidence as sort of complementing the randomized clinical trials and helping us have a conversation. But I think, patients who have typically not enrolled, whether they're a minority or they have some other comorbidity or they're older, I think, not that they're aware, I don't think they're out there looking for real world evidence trials for them, but I think they're going to have an appreciation that, these studies are done and they look specifically at someone more like me in the real world evidence. I think it'll be a little, give some more confidence to the patient, because the patients, it's a shared decision and they have to sort of feel good about the decision they're making. And I think presenting this kind of information to them is will be helpful. I think and maybe over time patients start thinking about this more and more, not just us trying to learn from it. So I think it's useful all the way around, both for us and for the patients.
Yeah. I mean, the interesting thing is, we always get this as docs. How many patients like me have you treated? You'll get that, especially if someone has an uncommon condition. How many, someone comes with metaplastic breast cancer, just as an example. It's not really related to our topic, but I think that, a lot of us may not have seen a lot of that. But if we can turn not just to clinical trials, but to large collections of people who have seen a lot of it, and this is the natural history of the disease, or this is the effect of a particular drug in the real world in this particular kind of rarer or more uncommon situation. I think it's kind of like answering that question for the patient. Well, I may not have seen a lot of you, but here's a lot of people who have, and here is kind of what the consensus is. That's kind of an interesting way to look at it, I think.
Yeah, I agree. I think to sort of summarize, I think real world data, in presenting it to the patient, we're presenting them something they didn't know they needed. And when we give it to them, they're going to they're going to sort of have this appreciation for it, that we're, not just looking at the randomized clinical trial, but, at all the patients who kind of walk through our door, that we're sort of trying to see how all these patients do with all these newer medications. So thank you for the conversation. Thank you for listening. And thanks, Dr. Brufsky.
You're welcome. And again, thank you everybody for listening. Thanks for having me.